All over the world, more than 37 million people are living with a virus that causes AIDS or HIV. 21% of these people don't even know they are living with HIV and AIDS. Meanwhile, here in the Philippines, we have the fastest growing number of HIV cases in the world. And unless very serious steps are taken and trends continue, an estimated 250,000 Filipinos could have HIV and AIDS by the year 2030. Here on the program today, we want to know why this is happening and what can be done to address this serious public health issue. I'm Dr. Freddie Gomez, and you're watching Med Talk Health Talk here on CNN Philippines. In 2018, 38 million people globally were found living with HIV and AIDS. More than 20% of these people were not even aware of it. Our country is seeing an alarming trend. The rate of increase in HIV is the highest in the world here in the Philippines. A UNAIDS report finds there are more than 13,000 new HIV infections by the end of 2018. That's more than 200% increase in infections compared to 2010. We need to understand the situation better. And joining us on the program is Dr. Louis Ocampo. He's the country director of the United Nations Program on HIV and AIDS, or UNAIDS, and HIV advocate, screenwriter, and professor Wango Galyaga. Welcome to the program.
Thank you.
Let's start off first by giving the audience an idea of the situation right now here in the Philippines with regards to HIV and AIDS.
Yeah, to set the tone for this discussion, I want to reiterate and put emphasis that the Philippines is now the fastest growing HIV epidemic in the world at 203%. That means that in 2010, we started at 4,000 per year, and it has ballooned to 13,000 by the end of 2018. And not only that, I mean, in terms of AIDS-related death, we indicated at least 285% between 2010 to 2018 as well.
285% increase?
Increase between 2010 and to 2018 as well.
Okay, and is this trend still continuing to rise? Are we seeing a plateau or even to slow down a little bit?
The trend will still continue if we do not provide out-of-the-box intervention.
Who do you think are most vulnerable to this epidemic?
I think at this point, it's anyone who is sexually active and anyone who doesn't use protection. What is happening now, based on the data, based on sexual activities or whatever, there's a lot of sex going on out there, and what's happening is that with multiple partners, accessibility of sexual partners. If we are not taking care of ourselves, if we're not using protection, there's the possibility of transferring viruses to each other.
And just to make everyone aware that you yourself were diagnosed with HIV.
In 2008, yeah. I was diagnosed in 2008, and because of the gestation period, HIV affects different people in different ways. So I know somebody who was infected, and then within 1 year, 2 years, they started getting sicker. Their immune system was really damaged. I was actually abstained. I was actually chaste.
Okay.
During 2007, I'd given it up for a while. So that's my promiscuous period, as I'd like to call it. I was actually very promiscuous, or I was having multiple partners in 2004 to 2005. That's probably when I got HIV. I only started getting I only started getting sick in 2008.
Okay.
So that was a long period of time before I found out the possibility that I could have had HIV.
Okay, during the program, we'll talk about some of your experiences.
Sure.
And of course, everyone would like to know how you're doing now. You're obviously looking great, feeling great as well.
Yeah.
But before we go into that, to talk about your journey, Dr. Louis, what can we do right now? Just a quick a glimpse of what kind of hope does the Philippines have in slowing down this epidemic?
Well, just before I answer that, I just want to say that based on our estimate, there will be 90,400 new cases for the year 2019.
Okay.
And around 68% of that will be coming from the young age group, 15 to 24. And this is where we need to focus our interventions providing strategic approach in terms of reaching the young key population because this is the bulk of the new infections that we have.
Okay, you mentioned the age group of 15 to 24. Is this the age group that is most vulnerable right now of contracting HIV and AIDS?
You are correct, including the men who have sex with men and the transgender women.
Okay. Now, there's a lot of stigma when it comes to HIV and AIDS that is only localized with a certain group of people. A lot of people may think, oh no, it won't affect me, but this is not the case, right? And we'll talk more about that, but first we have to pause for a quick break. This is Med Talk Health Talk, and today we're talking about the current situation of HIV and AIDS in the Philippines. We are seeing a country with the fastest growth rate of infections of the virus in the world. We'll be back after a short break. We're back. I'm Dr. Freddie Gomez, and you're watching Med Talk Health Talk. In observance of the annual World AIDS Day, we are spending time today to talk about an alarming situation in our country. This year's theme is Ending the HIV and AIDS Epidemic Community by Community. A UNAIDS report finds the Philippines is seeing the fastest growth rate of HIV and AIDS, and the patients are getting younger. Why are cases of HIV and AIDS high among the youth? So let's bring back our guests for today, Dr. Louis Ocampo, the country director of the United Nations Program on HIV and AIDS, or UNAIDS, and HIV advocate Wango Galyaga. Okay, earlier before the break, Doctor, we talked about how a vulnerable age group was that of the 18 to 24. Now, my question is, Wango, do you feel strongly that this is really the case?
I guess we just have to ask ourselves honestly and find out when did people, or how the people that we know around us, when did they first have their first sexual experience? When did we have our first sexual experiences? It's a lot younger than I think a lot of people would prefer.
Right.
But it's an age where we are starting to get, puberty hits, hormones hit, we get curious. And yes, there is a lot of sexual activity happening at that age group. And they become vulnerable because they're not properly equipped. They're not properly educated. We don't have policies in place that gives proper sexual health, reproductive health education to people of this age group.
Now, why do you think this is the case, Dr. Louis?
Filipinos are engaging into sex younger, at 15. That's the sexual debut of Filipinos. And they start using condom at the age of 18. So there is a protective gap between 15 to 18. And this is why the young people are more vulnerable now to getting STIs and HIV.
Let's talk about, doctor, since we're in this topic, let's talk about the ways in one person contracts HIV. So part of that, of course, important parts of sexual contact, but there also is a mother to fetus way of contracting AIDS.
You're correct. So for mother-to-child transmission, that's another mode of transmission, but it's getting less, at less than 1%. Needle syringe is also another mode of transmission.
From drug use, needle sharing.
Exactly. So, but of course, with the standing, war on drugs that we have in the country, we have limited options in terms of providing harm reduction program.
Okay, but the bulk of the cases still was from heterosexual sex and homosexual sex.
I would say homosexual, male-to-male sex, rather than heterosexual.
Now, do you think this type of culture or this type of notion, Wango was mentioning about how kids are having sex at an earlier age, do you think this is something that the government can do, or is this like a parenting problem? What could be the case?
I think the issue that we have, I think, is it's a social one. It's a society-based one because I think it's easy to safe to assume that we are in a society that is very conservative, very rigid, and it's very tyrannical about its conservatism. We are not talking about sex and reproductive health as if it were a medical issue.
And do you think the stigma of HIV
is inherent. It is inherent of that. You can't talk about HIV when 96% of transmissions is because of sex.
Right.
But when you talk about sex, people think that you are bastos, immoral. And it's not a moral issue. I mean, it's a biological issue. We have to talk about it like medicine.
Right, right.
And because of internet, access to material that it can be sexually explicit or hypersexualized like we do now in our television, we have to talk about it earlier. We wait until the last minute, and by then they're already experimenting with sex.
Yeah,
Okay.
and the new AIDS law mandates that all parents should start providing age-appropriate, education,
Okay.
including the schools to institutionalize comprehensive sexuality education.
Since we're speaking about what is age appropriate, in January this year, President Rodrigo Duterte signed a new AIDS law. And among other things, the measure lowers the age of HIV testing from 18 to 15. It means 15 to 17-year-old teenagers can go ahead and seek help and get tested for HIV and AIDS without parental consent. But despite this new law, why are cases of HIV and AIDS still rising in our country?
Wango mentioned about stigma and discrimination, and that still persists. And that hinders actually the key population to access testing, treatment. So I think to be able to reach our goal, we need to address those barriers.
Okay, and since we're there, let's talk about a very important factor, and that is to be tested.
Right now, we're doing facility-based testing, we're doing community-based testings, but we need to add additional strategies. Right now, we're introducing self-testing because there are key populations who are harder to reach that will not go to a facility for testing. So the self-testing will give them, freedom, the privacy and confidentiality they need. So,
but I think it's wonderful to be able to get them access. But I think what I love about the institutionalized, the ones that are provided for by NGOs and support groups for the testing is that it also they're mandated to give pre-counseling and post-counseling.
That's very
because
important,
that's the important part. Because you can do the test on your own, but if it comes out as positive, some people are not emotionally prepared to handle and deal with that realization, with that discovery.
Self-testing is part of the program, part of the push. But one thing is, how long will it take for one to get a result?
with the new methods that we have, we can easily get the result.
Okay.
So, we have community health outreach workers who do the testing in the field, in the community, and then you get the results immediately.
Okay, so
In less than an hour,
in less than an
actually.
hour. Okay, so less than an hour. So much has changed, much improved. That is definitely good. But how can they get it? Do they go to a drugstore, and is it like buying condoms, or you can get a test as well, or?
Well, the community health outreach workers are going to the community. So, the self-testing is not in place yet, but this is the next thing that we want to be in place.
At least people there know. So a lot of people might be watching and they're curious. They want to know. They want to get tested, but they're just not sure how. Waiting for any medical test results are nerve-wracking. And for those who find out they're HIV positive, what are the next steps? We'll also take a look at what's stopping people from getting the help they need. We'll be back after a short break. This is Med Talk Health Talk right here on CNN Philippines. World AIDS Day is observed every December 1st, and this year's theme is Ending the HIV/AIDS Epidemic Community by Community. World AIDS Day was first started in 1988 by the World Health Organization, and the goal then was to create awareness about HIV and AIDS. At the same time, it is meant for people to come together and unite in the fight against AIDS. Still in the program is the country director of the United Nations Program on HIV and AIDS, or UNAIDS. That is Dr. Louis Ocampo. And we also have Wango Galyaga, an HIV advocate, scriptwriter, and professor. Okay, so going back to the discussion, we were talking about getting tested before the break. And then what would someone do if they have the test? Obviously, if it was negative, life goes on. But when it becomes positive, what happens next?
So if you're diagnosed positive, your life doesn't end there. We have a very effective treatment, and it's for free. The government is giving it for free. So you just have to go to the facility and start on treatment immediately.
I think that's great news, but are there any qualifications? Or as long as they just test positive, there's no, like, sometimes there's some income bracket for it to be free. You have to be at this certain bracket.
You have to be PhilHealth member.
PhilHealth member,
Yeah.
okay.
Yeah, and then it doesn't have to be, because before you have to have a certain level of blood test, CD4 count.
Okay.
But right now, it's we're proposing to have a one-day initiation. So after diagnosis, immediate initiation of treatment is really necessary.
Okay, so all of that, it's already established. People who come out positive in the test where do they go again?
We have 121 treatment facilities across the country.
Okay. Now, the Department of Health, or the DOH, is asking to double its budget next year for its HIV program. The proposed budget is 1.2 billion pesos compared to $500,000 this year for 2019. What are the health department's plans next year on HIV and AIDS?
We're bringing in a new drug, which is more effective with less side effects. We call it dolutegravir.
Okay.
It's not part of the treatment guideline right now, but we're pushing for its inclusion in the country.
Okay, there's also a program with the department, which is the 19-90-90, and the target of that is to be able to test people and get those numbers in for testing. Could you tell us more about this?
Well, the first 90 means that we need to diagnose 90% of the estimated PLHIV in the country. And the second 90 means that 90% of those who are diagnosed to be on treatment. And the last 90% of those who are on treatment should be virally suppressed. Because we now have a U equals U campaign, which means undetectable is equal to untransmissible, meaning if you are undetected, you cannot transmit the virus anymore.
Okay. Now, Wango, all of this in place, the situation is testing is free. Treatment, once you test positive, it is free. But people are still not getting tested. Why is that?
It's basically stigma and discrimination. The difficult thing is anything that is connected to HIV, society kind of puts them on a situation where they're considered immoral, they're considered exiles. There have been, I'm very, very fortunate that this is not the situation for me. I've never been discriminated upon or never felt stigma. But so many people who are HIV positive are still living in secret, because there are people who have lost their families, who've been kicked out of their families and homes. There have been people who've lost their jobs because of this. So there's a lot of people who are afraid to access treatment, to access medical services. They're even afraid to get themselves tested and have it marked there that they are HIV positive, because that means they have to deal with the repercussions.
Okay, but for people who feel that way, who might not have a supportive parents, or you are a good support group, there are groups here in the Philippines just for people like that.
There are many groups that are dealing with support groups. Love Yourself, the Red Whistle, AIDS, Pinoy Plus, PAFP, AIDS Society of the Philippines. There's so many.
So there's no reason at all. There's no reason at all for people not to get tested, not to get treatment. It is there. We have to put a stop, or at least slow this epidemic down.
I think the most important thing is that HIV is manageable. Once you find out your diagnosis, it's not the end of the world. You take your treatment. When you're taking your treatment, you become what we call undetectable.
Right.
The virus is so low in your body, it doesn't attack your immune system. And the most amazing thing about it is that you don't transmit the virus to anybody else, with or without a condom.
Right.
So the moment that people who are HIV positive, once they're taking the medicine, once they're undetectable, we stop HIV from spreading.
What can be done? We have everything set about. President Duterte is doing his best in trying to control this. What can people do?
We need to introduce new innovations. For one, we need to have PrEP. PrEP stands for pre-exposure prophylaxis. It's a pill that is being taken by those who are HIV negative, who are exposed to HIV. So this is another layer of prevention on top of condom.
Okay, that's great to know. And where can people avail of this or try to see if they're qualified for
Right now, several civil society organizations are providing PrEP, but for now, it's for a fee. But we're pushing for the government to take this on and provide this for free as well.
Okay, so for those who want more information about this, the testing kits, the PrEP, is there a website that they can check out or
Yes.
a phone number?
For one, the Love Yourself a web page, they can go to that and access, where the other facilities are.
Okay, so Wango, do you have a message for our audience?
Yes, I do. I think just what's most important is that we have to really evaluate ourselves, evaluate even just our relationships and our friends around us, and let's just talk about it. I think we need to be more educated, and I think we need to be able to pass on this education. That's all it takes. HIV is preventable. So all we need to do is just take charge of it, get yourself tested. If it comes out positive, it's not a death sentence. All you have to do is manage the virus. Get yourself treated, see your doctors all the time, and make the changes. It's something you can live through.
Okay, leave the last word with Louie.
The World AIDS Day is a perfect time to revitalize our HIV response. And I would like to summarize that into 5 Ps. One, political commitment, policy change, program planning, participation, and perseverance.
I'd like to thank again our guests, Dr. Louie Ocampo and Wango Galiaga, for joining us and sharing your knowledge for our viewers. A very important topic indeed. And thank you again for joining us. I'm Dr. Freddie Gomez. We'll see you next time on Med Talk Health Talk.